Good morning. We're going to be talking about hospital laundered scrubs. I'm Chelsea.
I'm Jordan.
I'm Lindsay, and I'm going to tell you about our topic and why it's important. So first I'm going to tell you a story about Joe. He's an OR circulator, and he was invited to a party tonight. Even though he has to work the next day, he decides to go ahead and go. So he stays out late at this party, and when he gets home, he takes off his scrubs and he throws them on the floor. When he wakes up the next day, he misses his alarm, so he's running late, and he just grabs the scrubs from yesterday and puts them on to wear again today. On his way out the door, his dog jumps on him, and he pets his dog before he leaves. So when Joe gets to the OR, this is what he looks like when he reports to be the OR circulator. So we're proposing the implementation of a hospital-wide policy requiring all staff involved in direct patient care be required to wear hospital laundered scrubs. This policy change would reduce the number of nosocomial infections, thus improving patient safety and quality care. The reason for our proposed policy change is because studies show a strong correlation between microbial infections and home laundered scrubs.
We've identified key stakeholders in order to carry out this new policy change. Nurses are probably our biggest key stakeholders, as they're going to be the ones who are mainly wearing these new hospital laundered scrubs at the first of their shift. Infection control is also another big one because we'll need them to record the rates and compare them with previous years. Unit managers are another big one because they'll be the ones who make sure that this change is being implemented within their unit. We've also identified CNOs, CFOs, CEOs. Environmental services will also be a huge part because there'll be this new, larger need for laundering scrubs and supplying the scrubs to each unit. CNAs are also a stakeholder because they'll be required to change into hospital laundered scrubs at the beginning of their shifts also. Our PDSA cycle starts with our plan. So our plan is to issue scrubs to nurses and CNAs, healthcare workers at the beginning of their shift, and require them to change after their shift. We'll begin this process at the beginning of a calendar year just in order to record and compare rates in comparison to other calendar years. We'll start small scale on just one unit, the medical surgical unit, and then depending on our findings, possibly create a policy that will implement this policy change on other units across the hospital.
So our next two steps are study and act. So study, we're going to actually get the data from a vending machine, and we're going to study what we found. Our nosocomial infections decreased on the floor, they increased. What are the findings? Then we're going to act. So based on this, we're going to refine the change. We're going to identify some barriers that we experience, and we're going to try to iron those out before we implement it on a larger scale. So we kind of, for example, looked at St. Luke's and what it might look like at St. Luke's. So we did notice that changing in locker rooms are pretty small, at least on the med-surg units we were on. So that might be a potential barrier, providing more space for nurses and healthcare providers to actually change into these scrubs. In addition, we also thought that nurses would be more apt to change if there was more time provided at the beginning and the end of their shift, so they could actually change into these scrubs. So part of the PDSA cycle, we looked at evidence-based practice and how this can be implemented and what are the ramifications of nosocomial infections.
So some of the evidence we found that supported our proposed policy change was a study done by Nordstrom and colleagues. He found a significantly higher bacterium count on home laundered scrubs than hospital laundered and new scrubs. A study discussed by Spruce also traced 3 specific instances of sternal wounds to the washing machine of a nurse anesthetist that was in on all 3 cases.
So Mitchell and colleagues found that sometimes porous items in rooms are overlooked as being transmitters of bacteria and infection. We know that in the hospital that we always see people wiping down bladder scanners and beds and IV poles, but what about the actual curtains and the scrubs and the porous items that the bacteria is actually can get in between the fibers? So he identified that they're difficult to disinfect and that they can transmit pathogens for large periods of time. Also, we found that to prevent the spread of microorganisms, there's actually quite a bit that goes into it. That the time that they're laundered matters, the type of machine, it has to be the right temperature, the right amount of detergent, and the right time washing and drying.
So kind of relating to what Chelsea just said, the evidence found that home washing machines weren't operating to the same standards that OSHA and the CDC has set for hospital laundered scrubs, so they were being inadequately washed. Also, there was a study done of residents and who were provided hospital laundered scrubs at the beginning of their call shift, and at the end of their call shift, the scrubs were removed and they were swapped for microorganisms. Of all the 300 scrubs that were swabbed and worn, there was an 89% contamination rate, so that's pretty high.
All right, so to implement this, we know that there's costs associated with it. So we need funds to set up and get the resources to implement an actual additional computer module so healthcare staff and nurses can watch this. So there needs to be more training time and the money associated with creating the module. Also, we thought that the addition of staff and a super user for the vending machine would be helpful so that nurses who are maybe a little bit more resistant or don't appreciate new technology or change, that the transition would be a little bit smoother. Funds to purchase the scrubs and vending machine. Informatics services, so we talked about how we were going to study the data, and part of that is having an informatics team to collect that data from the vending machine. And then the cost of laundering scrubs in-house, so that's commercial washers, additional staff to stock and wash the hospital laundered scrubs.
So informatics is a department, sometimes in the hospital, and they gather and track data for us. So using hospital laundered scrubs, it isn't just about the staff members putting the hospital laundered scrubs on as soon as they come on shift. Although we want them to do that, it's also about nurses and other staff changing their scrubs when they get soiled. So a vending machine on the floor stocked with scrubs would help informatics to track how often staff are changing their scrubs and those specific staff members, because they would use their badges to check out the individual scrubs. Informatics could also help us get this information out to the necessary people once we decide to go hospital-wide.
Our nursing interventions are pretty straightforward. Our nurses are going to be our frontline staff in implementing this change. They'll be required to change into hospital laundered scrubs at the beginning of their shift and take them off at the end of their shift, and also changing them when they're visibly soiled.
So the reason for our proposed policy change is because right now there seems to be a gap in policy. A new policy is needed to ensure that uniforms are always washed according to OSHA standards, and which with most hospital policies, there isn't, like some hospitals might require that they be washed at a certain temperature, other hospitals might suggest you wash them separately, but there seems to be a little gap in what hospitals are requiring how you wash your uniforms. And the easiest way to kind of standardize how this is done is to provide hospital laundered scrubs and require that the staff utilize them.
So here's our references. We feel like hospital laundered scrubs and the evidence that supports it is a really important issue. Thanks for listening to our presentation.